Hello, everyone. My name is Julie Bertarelli, and I'm the Operations Coordinator here at OHF. We have a wonderful OHF on the Road webinar for you here today. The OHF on the Road webinar is a place to learn, engage, and connect with families, patients, caregivers, including our industry partners. Through this virtual webinar series, we are uniting to build and activate the hyperoxaluria community at a very personal level. This three-part webinar series is for all to learn about emotional wellness. The next one is what's causing my kidney stones. And the last one in this series is to harness your power to make a difference while living or caring with someone with hyperoxaluria. Before we really get started with our wonderful speakers today, there's a few housekeeping items that I'd like to go through. Today's webinar is scheduled to last approximately 45 minutes. All participants will be muted to allow speakers to present without interruptions. The webinar will be recorded for later viewing on OHF's YouTube and social media channels. And to ask questions during the webinar, please use your Q&A box at the bottom of your screen, and we will answer them at the end of the webinar, maybe even a few in between. And if we run out of time, we'll follow up with you via email. We want to have a big shout out today and thank our sponsors who you see here up on the screen today, and especially our partner sponsors, Alnylam and Dicerna Pharmaceuticals. Today's topic is a special one. Some of the webinar goals today on balancing emotional wellness will be discussing and managing our mental health living with a rare disease, including the newly added pandemic's emotional toll. An open dialogue about mental health and discuss its impact on your life, outline some of the signs and symptoms to look for in depression, as well as anxiety, and to encourage discussion with your treatment team. And lastly, empower yourself and caregivers to engage in meaningful conversations about mental health. Our wonderful guest speakers today are Maya Doyle and Christy Ouimet. Maya Doyle is an associate professor of social work at Quinnipiac University and the Netter School of Medicine in Connecticut, and the senior social worker camp coordinator for pediatric nephrology at the Children's Hospital at Montefiore in the Bronx. Her work and personal experiences have informed her about the impact of chronic health conditions on individuals and families across the lifespan, with a focus on mental health and the transition from pediatric to adult care. She is committed to advocacy and research on behalf of individuals, families, and communities impacted by rare genetic conditions, and is working to increase genomic literacy amongst social workers. We also have Christy Ouimet with us today, parent of 2 children with primary hyperoxaluria, an OHF patient advocate, and also an industry patient advisory board member. I am going to now turn my screen over, and I'm going to stop sharing and turn it over to Maya, and she is going to walk us through this webinar. Hi, Maya.
Good morning. I guess it's the middle of the day for me here in New York, but I am really excited to see everyone. All right, let me get my screen up and shared properly. So I wrote sort of slightly different goals for today, but essentially the things that Julie just described. We're going to talk a little bit about the mental health impact of living with chronic and rare disease, although the honest truth is I'm going to do that the least because you are all actually living that experience. You don't need me to tell you what it is. When I give similar talks to healthcare providers, sometimes they need some reminders, but I think you all probably know that quite well. What I do really want to focus on today is learning about the ideas of mental health and wellness, and also thinking about what kind of services and supports you might be looking for depending on sort of what's going on. And we'll try to also make sure there's time to answer some questions towards the end. And one of the most important things I want to start out by doing today is just reducing that stigma or any shame or embarrassment or worry about asking for help in all the different ways that we might do that. So there's my big plug about stigma to begin with, right? Whatever it is that's going on for you or your family, whether you're a patient or a caregiver, there is really no reason to let any shame or embarrassment or worry get in the way of getting the support that you need. I think a lot of us, right, want to be strong and not show that we're vulnerable. But vulnerability is not weakness. Vulnerability is the place that allows us to grow and learn and change. I love Brene Brown. Before she was a multi-million-dollar philosophical rock star, she was a social work researcher like me, and her thinking about vulnerability and how that can help us grow and help us learn is really powerful to me. So, and what I have learned from all the patients and families I have worked with over the years is the level of creativity and good ideas that families come up with is far beyond many of the things that we do as professional, mental health folks and healthcare providers. Just to frame things for us to get us started, and I will not go through all of these things, but I think it's helpful to think about what we mean when we talk about health, and especially for folks who are living with chronic health conditions, as I do myself also, we still have to think about how can we be healthy with whatever diagnosis it is that we're living with. You will see that I use the word illness. I sort of sprinkle that throughout our conversation. I want to be clear that the way I use illness is not simply whatever the biological diagnosis or process is that you're living with, but the experience of living with that diagnosis, how you feel and think and respond to the world, and also how the world thinks and responds and treats you. And the experience of walking through the world with illness can be quite different for lots of folks. So we want to bear that in mind. When we talk about mental health, really broadly, we're thinking about how we think, feel, and act, how we cope when we're feeling stressed, how we get along with others, and how we make decisions about what do I do next? What do I do today? How do I handle whatever it is that I'm facing? We think about this idea of wellness as the ways that we take care of ourselves, the way that we live in the healthiest way that we can, the way that we perhaps get involved in, our diet and exercise and activities and things like that, practices that help us feel our best. There are lots of ways to do that, and we'll sort of talk about some examples. But as Christy and I have been chatting about all week, there is no one way to find wellness or to utilize wellness. And I most importantly also want to think about what it means to get help, because we get help when we look inside, we get help when we reach out to others, that our loved ones, our friends, strangers on the internet, and we get help when we reach out for professional services. So we're kind of going to talk about those three things as we go today. One of the things that I, as a social worker, really want to make sure I can do today is help you think about the types of therapy that are out there and what they do, so that when you're thinking about, hey, I need something else, you kind of know what you're asking for and looking for and know what to advocate for. One last piece before I toss this to Christy for a little bit is just this idea of stress and coping. And, stress is not a bad thing. Stress actually keeps us alive. It makes us go, hey, something's going on. There's something I need to pay attention and do something about. I woke up this very morning feeling a little bit anxious because I have a lot of little things that need to get done for my classes next week, and I have another presentation to give, but I also wanted to be able to be fully present with you all today. So I said, I need to get up, tackle some things that are on my list, little useless things I need to get off my to-do list. And then at 11 o'clock, I was like, or 10 o'clock my time. Now I feel a little bit better. I can tackle this today. So we have to really use that as something's telling me there's something else I need to do. And how do I open that valve and release that stress in ways with, formal counseling, in ways with venting to our friends, in ways of going outside and screaming to the sky if we need to, whatever it may be, that we find some way to open that valve. I love that stress bucket idea, and it's a really useful thing for me to think about. One of my students also talks about thinking about the glass balls that she's juggling that are going to crash, and are they glass or are they plastic, which I thought was beautiful. So lots of ways we can think about how we manage. I'm going to toss this to Christy for a little while so she can share a little bit about her experience supporting her kids and herself. I'm going to share some beautiful photos with you of her family, and then I am going to let her take it over for a little bit.
Hello. Thank you guys so much for having us be a part of this. This is incredible. I love the topic about what the whole wellness and the reaching out if necessary. So many of you guys know I have 2 children with primary hyperoxaluria type 1. And just as the disease can affect each patient differently, it's going to also affect the mental wellness of each person and how everybody interacts. I often tell people that just because I do have 2 children that have been diagnosed with this disease, but it affects everybody to a certain degree, and the extended family, everybody. So I've been very blessed that I have a very wonderful supportive family around that's been able to kind of pick up and go as we move forward with whatever needs to be done. Sometimes I realized through the journey that I had, for a lack of better terms, compartmentalized different things that were going on. And I just thought, I'm going to deal with that later. And that's how my stress got me through certain circumstances. But I also had to keep in mind that as a parent and a caregiver, I was experiencing my own anxieties and different things happening in life, but my children were each experiencing something as well. My oldest child was having kidney stones at 3 years old, whereas my youngest child went into kidney failure at 5 months old. So their needs were quite different, but they're also quite evolving throughout the years. So I've kind of had to learn to anticipate what their needs may be and try to help them cope as we move forward. One of the things that we struggle with is articulating at times what we may be feeling. And I'm not an expert. I'm not trained in anything other than just being a mom. And I kind of learned to just kind of take everything at face value with what the kids are presented with at that time. For me, mindset was the biggest thing that I really focused on because it was how I dealt with certain things that we were facing. But I also knew there was a time when I needed to get more help. And when I was working towards things, I also know my children are watching me for cues on how to deal with life and how to deal with different things. So we've been very open and honest on our journey. I know that they have different expectations on where they're at in life. And so that's one of the things that I really try to tell anybody who comes our way with things is what is it you're experiencing at the time and what are your expectations? Do you just need to talk about something? Do you need more help? Do you need answers that somebody can't provide? Whatever it is, a lot like what Maya was saying, it's very general. And it's important that you're kind of in touch with what it is that your needs are and that you know how to go about reaching out for them. So I encourage everybody to, especially when you have your children there, yes, you do need to take care of yourself, but I know as myself as a mother, if my children were doing okay, then that really eased the burden from me, knowing that we can get through things, because there's a lot of things that aren't fair that our kids have to face. It's very important to work as a team with everybody that's involved within your family. Keep things, when you're talking to your kids, be honest, but don't dump your fears and anxieties on your children. They have enough to deal with. Reach out to somebody. And if you don't have anybody, we have support groups on Facebook. We have different organizations and things. If you are struggling with trying to find that avenue, reach out to somebody, because we do have people like Maya who are professionals, and we also have people who are parents or patients who have experienced things, and we're all willing to work with you for things. The most important thing is to not suffer in silence with any of it, and to maintain having that hope, but also understand it's going to evolve as time goes on. Things are going to get better, and then there's going to be some times when things struggle. Just don't ignore them. And that's basically the experience that our family's gone through. What we've also experienced is constantly changing within our children with their ages, because when you have a baby going through something, you just kind of experience it. But as they move on to teenage years, we all know that changes the dynamic with things.
I've got a 14-year-old now. I know it too. I started in pediatrics as a social worker without any children. And all
Oh,
the moms laughed at me when mine arrived.
that's right. That's right. I've told my children, especially when they hit those teenage years, there's a lot of things you're going to experience that maybe aren't fair and that you're not going to get to go through as most teens do. But it's very, very important that when it comes to your health, that we have honesty and that there is complete cooperation, because you can get upset and you can get defiant in other aspects. That's fair to say, but with this, it's important. And I'm very fortunate. My children, they will come to me with a lot of things, but they also understand that maybe there are some things that I just can't help them with, but I can help them navigate with what they need. And there is zero judgment. I never tell anybody what they should feel. I never pity anybody or do anything like that. That's another thing that's very understanding, to have empathy and to experience things versus having somebody who has pity on you. That doesn't help. So it's very important that those feelings and those experiences that you have are yours. And if you want to talk about it or get help from that, that's great. But they are yours to experience, and I will never tell somebody how they're supposed to feel.
That's so true, Christy. Thank you so much. I'm going to keep us moving with our presentation, but let's just keep chatting as we go. So these are just some bullet points from Christy and I talking earlier in the week. So I just wanted to include these so you'll have them when you look back at this. But what we were talking about actually moves us really nicely into sort of thinking about those different kinds of support that you might want to reach out for. And please know, when I put this together, I was thinking of both, parents and caregivers getting support for themselves, thinking about teens and adult patients who are getting support from themselves, and a little bit of what you might be getting for your younger children as well. The types of services aren't necessarily that different, although who you might reach out to might be different. And we'll talk about that in a moment. So we're mostly going to talk about some areas of professional support today, but I also want to give a big shout out for peer support, because frankly, I think it's one of the most important things in living with any kind of illness and living with rare disease, to have connection to other folks who get it. And then I also want to make sure we spend a little bit of time talking about self-care. There are lots of reasons that we might seek out professional help. I should stop putting things in air quotes. I'm sorry. I'm not going to go through this whole list. I think you can all see it. We'll talk a little bit more about depression and anxiety in a moment. The thing I do most want to point out is that bullet point on the lower right about post-traumatic stress. I think this is an underappreciated part of the medical and illness experience for so many people. And the more conversations I have, the more I think about it, that as caregivers and as patients yourselves, you are asked to be vigilant and aware of things that, beyond what most people need to. And you may be facing traumatic experience, which means a traumatic experience is one where you feel you or a loved one are at risk. Your life is at risk. Well, if you're living with illness, you're going through medical procedures, all of those things, you're very much confronting that on a pretty regular basis sometimes. So I think we really have to acknowledge that there's as much risk for post-traumatic stress there as in other kinds of, dangerous situations. It can mean both people being hypervigilant and not able to relax, not able to let go of anxiety. It can also mean being withdrawn and being disconnected from the rest of your life. So it can go in either direction. So I just want to throw that out there as an idea for you all as you're thinking about what might be going on for yourself or for your loved ones as things proceed. And the good news is there are lots of ways, just like with everything else on this list, to sort of approach these topics. And you're welcome. Put things in the Q&A. We'll try to answer questions as we go. This is a much simpler way of thinking about depression and anxiety that someone shared with me a couple years ago, and I just loved it. And I think it's a helpful way for us to think about this, that whether we're dealing with illness, whether we're dealing with something else difficult that's happened in our lives, that depression and sadness really has to do often with shame. Oh, I wish that hadn't happened, or I wish I'd done things differently, and just loss, that it hurts so much that I don't have what others have or what I had in the past, right? So we get kind of caught in that loop in the past. And anxiety is our worries about what's going to happen next. And obviously, when you're living with illness that's often unpredictable, it's very easy to get caught in that cycle of worrying about what's going to happen next and how do I manage that. The patients and families I've met who manage to strike a balance between acknowledging both sides of that and sort of being able to focus on what can we take out of this moment, out of the now, seem to manage the best over the long term. But that takes time to even develop sort of as a philosophy, as a family, that this is how we're going to go through things. So there is no one way to approach that. But I think it gives us a nice sort of gentler way of thinking about this that isn't about an anxiety or depression diagnosis. There I am with my quotes again, but that it's just, this is how we're feeling about what we're experiencing. There are lots of folks out there who can step in to provide mental health services if you're needing them. This is just a partial list. I tried to tamp down my ego and put social work like somewhere in the middle, but the honest truth is 75% of the mental health professionals in this country are social workers. If you are someone who is dealing with dialysis or transplant, you probably have a social worker who has to be part of your team. So that is a great place to start. Even if they can't provide ongoing therapy, they're at least going to be trained to have that awareness and connect you with someone who can, and or provide at least some short-term services. But there are also lots of other kind of counselors, marriage and family therapists, psychologists, school psychologists, if you've got a school-age child, psychiatry, particularly if there's need or thinking about medication or other kinds of diagnoses. And you may be seeing someone in private practice, or you may be going to an agency in your community or at your hospital. And certainly thinking about how do I find someone, working through that healthcare team, working through your insurance, working through whoever you know to get started is a good first step. Sometimes it literally means, let me sit down and see what I can Google and get started there. But then, moving along from there. One of the things that I'm really happy about is that over the years, we are doing better and better screenings across all kinds of healthcare settings. If you have a child or you yourself are in the dialysis setting, we do quality of life assessments on a pretty regular basis as part of our sort of quality improvement, making sure we're providing good care in those settings. But even when you go to your pediatrician's office or other offices, they may do a quick screening like this just to figure out, hey, is something going on that we should, refer someone on for more services. So, and if these things aren't happening, you can also find these things online and even just do a screening for yourself and go into your doctor or your social worker, or your nurse, and say, I noticed I'm having these symptoms. I wonder if there's something else we should be doing. So I just wanted you to be aware that these things exist. So often the thing that we're really thinking about when we're feeling so overwhelmed is just getting some support, right? And there's support out there for sort of how you're feeling about yourself. And there's support out there for how you're getting along with other people, or if you're having conflict, say, between parent and child, or between spouses, or not even conflict, but we're just struggling with what to do next. Or we've had some losses we've adjusted to or trying to adjust to, life being different now. As Julie said, as things evolve over time with different phases of both development and of the illness, right? How do we cope with these things at different times? And there is one-on-one counseling you might reach out for, as well as being part of a structured group where you can kind of talk about things. I will tell you straight off the bat, you are probably not going to find many mental health practitioners who know about oxalosis or hyperoxaluria or any rare diagnosis. Just know it doesn't exist. Hopefully you get one of the great social workers that myself or one of my health colleagues has trained, that they know a little bit about talking to people with, illness and health concerns and or disabilities. But we do generally all have the same background in certain kinds of assessment and counseling. But just know that you're probably going to have to do the same thing you do in lots of other parts of your life, which is give some teaching about your particular health issue if they need it. So just forewarned is forearmed. It's probably going to happen. I try to encourage people to think in broad terms about what does it mean to live with a health condition, what does it mean to navigate this, as opposed to maybe the specifics of what you're going through. But of course, the specifics of what you're going through matter too to how you're coping. The other kind of therapy that a lot of people end up seeking, and I particularly want to think about what Christy was saying in terms of kids doing the things that they're supposed to do, or maybe not doing the things they're supposed to do in terms of adherence with treatment, is often the big challenge we see with teenagers. There is a lot we can do to try to help motivate and change behavior. And I will not give you huge details about this, but I wanted you to have some names and some thinking about these things. And honestly, that piece about, knowing the truth. Tell us what's going on. If we don't know what's going on, maybe we'll be able to tell from your labs sometimes, right? We can see what's happening because your, lab levels are off for your medication, or your phosphate binders are clearly not being taken, or whatever it may be. We may be able to tell looking at your labs, but we really don't want to have to argue with you or have you tell us, oh no, those labs are wrong. I grew up with type 1 diabetes. I know all about saying, oh, those labs can't be right. Don't pull it with me. It's not going to work. Being honest with us, let us know what's going on. As your medical team or as your family, let us know where it's difficult, because maybe we can come up with solutions. If we don't know and you don't tell us the truth, we can't do anything. So, we know it's hard to talk about. And sometimes it takes people some steps to getting ready. We're not all always at the moment of like, okay, I'm going to do this now. I have too much on my plate. I'm thinking about it, but I'm not ready to take action yet. And that's okay, as long as it's not something life-threatening. And we will talk about life-threatening things in just a moment. I just wanted to put a quick plug for what cognitive behavioral and dialectic behavior therapy are, because those are sort of buzzwords in my industry that you may hear. But really the most important thing to know, and what I love about this idea of cognitive behavioral therapy, in a nutshell, it helps us connect what we're thinking, what we're feeling, and what we do, what actions we take, how we behave. Because sometimes, right, we're triggered by something, we react very quickly, and we respond in a way that, like, maybe that's not the most effective way to deal with this. And so basically what that therapy seeks to do is kind of slow down that process and help people think about, how do I change my thinking about something, sometimes in really subtle ways, or how do I change how I respond to the thing that I'm feeling, right? How can I respond in maybe a healthier way or a less damaging way if it's, say, impacting how I take care of myself, or impacting how I get along with the people that I care about, or how I get along with people at work, or how I get along with people at school, which is often the big challenge for our kiddos, right? So just, again, something to think about. This is one of my favorite kinds of therapy. If you encounter it, or you have anything that crosses your radar about being solution focused, I love this, because it's really helping folks think about, where do I want to get to? Where would I like to be? And I did this with another rare group that I worked with a few years ago, and it was really powerful. This idea of this question, that if you woke up tomorrow and your biggest problem was gone, how would you know the world was different? How would you know things had changed? And of course, my caveat in a group like this is, short of a magical cure for your child's diagnosis or your diagnosis, that I can't promise yet. But what other things might make life different? That how would you know that something had changed? We did this a few years ago with a different illness group, and a family started talking about the fact that they used to go camping and do outdoors activities a lot. And because of their child's diagnosis, they found they weren't doing that anymore. And they shared it, and another family instantly piped up and said, oh, wait a minute, this is what we've done. This is how we've adjusted. These are the things we do. So this also speaks nicely, not only to doing this with a professional therapist, but also the value of peer support, that other people may say, oh, wait, this is how we did it. This is how we got there. So I think it's a really helpful way to kind of think about, and even on those dark days, you're like, I don't know how we're ever going to get there, kind of having that vision, right? And it may be, these are the things we're going to do, post-transplant, for example, the places we want to go, the things we want to try. Sometimes there's a waiting in there. But that idea of having that step to look forward to and to work towards. And then the goal of therapy is to think about, what are the steps we need to take to get there, right? Most modern therapies in this day and age are time limited. You might get 10 weeks, you might get 12 weeks. You have a limited amount of time and some goals to try to accomplish. So ideally, whoever you're working with in that first session or two is going to think about, what are your goals for coming here? What is it you want to accomplish? And it may be, I just want to feel better. I just want to not feel so overwhelmed. And that's a totally legit goal. But just kind of know that that's usually part of the process of taking part in therapy, is thinking about what those goals might be. Another piece that I think is really important is the family piece that we think about, that either individually you are talking about things that are going on with your family. So whether that's your, kids and teenagers being able to talk about, hey, this is what's going on with mom, or whether it's a process of talking together. And there is some specific medical family therapy that does exist out there, as well as just generic family therapy. How do we sort this out? I worked with a young woman with lupus a few years ago, and her sister and her mom. And they weren't fighting about how she took care of herself. They were arguing about, who was doing the laundry and who was doing the household chores, but constantly. And when we really started to pull it apart, underneath all of that argument came out all of this worry about how different people were coping with living with that medical diagnosis and managing that illness piece, right? So sometimes we have sort of superficial things that cover up for the really deep down uncomfortable stuff we don't want to talk about. So again, many different ways of approaching this that might get recommended to you, or you might consider, again, depending on what's going on. If you are concerned about a smaller child, there are lots of therapies really geared, obviously, towards kids. They tend to be much more sort of activity-based, using play, using art, using things like that. If you're encountering child life specialists in the hospitals that you go to, those people are my heroes. They do such a wonderful job in helping kids express themselves. They may have ideas for you all and what you can try at home. They have great ways of helping reduce some of that stress of what is it to go in for a medical procedure, or how are we spending time on dialysis, things like that, so that they can be an excellent resource to reach out for. Obviously, if you've got school-age kids, really involving that whole team of school social worker, psychologist, guidance counselor, principal, teachers, whoever it is that you can pull into that loop so that they understand what's going on. Yes, it's exhausting sometimes. I feel like I'm watching Christy's face going, oh, that's so much work, right? But pulling that team in, and also finding some allies amongst, your kids' friends, amongst sports teams, amongst friends at church, whatever it may be, so that your child knows they have some allies, especially if, they're feeling, like an outsider, or they're getting, grief from some classmates. Unfortunately, it happens. Kids are kids. I think we've come a long way in how we help kids understand that everybody's got something. I love it when I talk to my son, like, some kids have allergies, and some kids have health conditions, and some kids have learning differences, and everybody in the classroom kind of goes, okay, so what's your thing? And there seems to be a little less stigma around that. I may just be an optimist. I think it's better, but we do have to actively think about how we build support around our kids in that way. If you are in real crisis, meaning if you are feeling so badly that you're feeling like you want to hurt yourself or someone else, or you're seeing your loved one feeling that way, please, please, please do not wait, and do not stay silent. There are ways you can reach out by phone and by text to crisis hotlines. I mean, these are your famous prevention hotlines. It's a place to start, and they can then connect you to local resources. Many states have state hotlines. In Connecticut, where I work, we have a 211 hotline, which is phenomenal. Anybody can call. They can get mobile crisis out to a household very quickly to actually provide help on site, not even you having to go to the emergency room, but to get someone to you and on the phone to you quickly. I've also had some nice experiences. Patients have told me about using the chronic illness hotline. That is not as immediate. They call you back, but is again a good place to start, to say, I just need to talk to somebody and figure out what my next step is. So I wanted you to just kind of have these floating out there as places to start if you don't know where to start with your team at home. My hope would be you've got at least one person on your team that you feel enough trust and comfort with that you can reach out and say, hey, something else has to happen. Last couple things I want to talk about, and Christy and Julie, jump in if there's stuff in the chat that we should talk about. I can't see it right now. Peer support is so much better than anything I can do as a social worker. I admit it. It's true. I think it's true. Being able to vent to people who really get it. I don't know, I'm sure because of COVID, right? Many of us have not been able to be together in lots of ways. And that's a whole other piece, right, of how that has shaken our mental health as individuals and as a society. But being able to be together when you all, I'm sure, have patient and, family conferences. I know with a lot of my other rare disease groups, that experience of walking into a room with somebody who gets it, somebody that you don't have to explain it all to, is incredibly powerful. Christy, am I right? What was that moment like? Do you remember the first time that happened for you?
The first time it happened for me when I was at a high stress level was when my son was 5 months old and we took him to the children's hospital in kidney failure. I didn't think he was going to make it through the night because nobody had heard of anything. And I thought, I am going to have to try to explain this to another doctor. And the doctor at the facility that we went to interrupted me and said, I just want you to know, I know this disease. I've successfully treated it. You're at the right place. And I thought, oh, finally, somebody else who knows more about it than I do. And I didn't have to stress. And then when I asked, well, how many families have you treated? And he said 2, but we're batting 1,000. So I thought, okay. And then I did later get introduced to the very first patient who went through it with the mother. And so just knowing that if I had a question about something, I can directly contact them was huge.
Yeah, I
And
think
knowing my biggest stresses and concerns were questions about things of the unknown, of not knowing some of the other aspects, and then being able to reach out to Julie or Kim at pretty much any time with a question. And if they didn't have an answer, they were helping me find one. And that was such a huge, tremendous relief for me to just know that I wasn't alone in that aspect as well.
So there's so many ways to get that support, obviously, through online groups and Facebook groups, through, Zoom events like this, but also just, drop in chat groups, phone support, in-person support when we can hopefully all do that again more easily, all those different ways. And it may not just simply be around this particular diagnosis. There could be lots of other types of peer support that that you get or that you take part in, or you may be part of, a smaller organization and then a bigger sort of, rare disease community more broadly that you're part of, or an illness community that you're part of, or, the book club that you take part in, in your neighborhood. It can fill so many different needs, but that idea of being able to both learn from other people's experience, know that you're sharing that experience, and eventually also, I think, being able to give back. So when you are at sort of slightly higher up on that coping scale, you can share back to somebody else.
That's been a huge thing for me too, was with all the different things that were going on that I didn't have control over, I was able to use my experience in another outlet to help raise awareness and to encourage other people to be involved in our story, which then kind of blossomed into other aspects. And I think that was something that was huge. And I try to share with other people is it helps empower you to be able to take back some of that control you lost, even if it's not specifically related to your health journey or something there, to be able to help others or to be a part of this larger community and knowing we're doing something. Because a lot of people claim, someone needs to do something, but those someone's out there are all of us. And if you have an opportunity to do something, do it. And it really does help with that feeling of helplessness.
Yeah, for sure. Absolutely. Thank you, Christy. This is just another way of sort of saying the same thing, that idea of connecting to others. These are actually some findings from some research work that I did with another rare disease group. If you poke around, or I'll see if I can send it to Julie to kind of share, because I think it fits across lots of folks' lives in terms of, coming to understand and know what it is you're dealing with and getting educated, figuring out what are the routines that are going to get us through the day, figuring out what's our philosophy for how hard we're going to push our kids out in the world, how much we're going to protect them, how we connect to others, how we kind of fit this illness into our lives. And much like we talked about 15, 20 minutes ago, right? How do we find that little space for focusing on the now and what's going on right now and valuing and enjoying what's going on right now, even when it's not perfect? Just trying to, hold on to that. Last piece just to think about is this idea of self-care and how we take care of ourselves. I am very, as a social worker, I'm supposed to be really gung-ho and excited about the idea of mindfulness. And I have to tell you, I'm not, because I went to a conference once and they had us do some deep breathing and observe the world around us and think about being mindful. And I went home and I had a panic attack because I wasn't being mindful enough. So I said, I have to think about how to make this work for myself. And how do I understand this before I can talk to other people? And what I really think is important is that idea of taking time for yourself. Yes, being aware of what's going on around you and in your own body, but there are so many ways that we can do that. We can do that through all of the sort of traditional deep breathing and meditation and yoga and exercise and all those great things. But we can also do that by taking a little time for the hobbies we enjoy. I claim, wait, where's my coffee cup? I claim that sitting down in the morning with my cup of coffee for 5 minutes is my little mindfulness window in the course of my day. I do try to claim that 5 minutes with one of my cats, none of my kids, and not my spouse. But whatever it is that works for you in that moment. Some people find that journaling is really helpful. Some people find that thinking about what am I grateful for today? What am I happy about today? What's the good thing in a challenging day? Finding those things may work for you. Other people may find I write things down in a journal and then I want to rip them up the next day and I don't want to read them again. Sorry, that's just me. There are lots of opportunities and ways to think about how we take care of ourselves. It may mean thinking about what did I used to do in the past and how can I reclaim that and find it again? Or is there something new I can try? So I just want to give you the wherewithal to choose whatever it is that works for you, to not feel that you have to keep up with anybody else, and to be creative in finding that little space, ideally, in your daily lives to do that self-care. If you're good at it, if you're good at spending more time, if you can carve out more time for yourself, or if time for yourself means spending time with your family, some of us really enjoy that, that's okay too. Right? If taking the kids ice skating is the thing that makes you feel relaxed and calm and happy, no. Whatever works. Come on. So Chrissy, what's yours? Come on.
We actually here, we have puzzles we like to put together because it's something we can do and watching TV. Yeah, so everybody has their own thing and we all kind of coexist together, but we also have enough space in this house that people can kind of go in their own direction. Movie nights, things like that, things that are down low. Yeah,
absolutely. So please, everybody, please be creative. The last thing I want to say is just that we all have to find our own sort of ways of getting through these things. Think about who the people around you are. Think about who you can call on. I had someone say something brilliant to me once, that it only takes a second to ask. It only takes a second to ask someone for help. And the worst thing they could do is say, no, sorry, I can't do that. Right. And then you got to look elsewhere. But it only takes that moment just to ask and say, I really need someone to, pick my kid up after school today, or, do some babysitting, or bring me a casserole, or whatever it may be. Or, hey, I just need 5 minutes to vent before I go back and tackle whatever it is I have to tackle. I love this little kitten.
On a side note also with that,
Yes.
I learned that I am going to have to learn to say the word no.
Yes.
If I was that person who, hey, would you be able to do this? Would you do that? And I'm like, I could, but I'm going to be so packed with, I have these things and I'm still struggling with that on some aspects, but that's something I did learn, that it's okay as somebody who's always trying to help others. It's okay to say no.
Yeah. I do think that's a personality trait. It's really hard to get away from that. But if you figure it out, please let me know.
Someday.
Because this is us hanging on.
Yeah.
Some days you don't feel like you're hanging on to anything, which is why I love this little kitten floating in the air. I remember having these posters like all over my dorm room in like the early 90s. Right. But sometimes faith is the only thing you've got. And that sense of like, I just got to hang on and somehow we'll get through to tomorrow. And then hopefully something will clear, something will bring us along, or someone will bring us some good news, or someone will tell us a good joke, even on a rotten day. So all the ways that we can think about how do we find ways to buoy ourselves up or buoy up each other, is I think the most important piece, and we all have to do that in different ways. I just want to thank Christy and Julie for asking me to do this. I want to thank all the patients and families who have shared their stories with me over the years, all the advocacy groups that have given me a chance to have these conversations. I am happy to answer some questions if I can. I'm sure Christy has things to say as well. And I am reachable if anyone wants to write to me. I will unshare my screen so we can see people. Well, you can see us, we can't see you.
One thing I'd also like to mention is it's frustrating at times because things are limited, but that's the way our life has always kind of been. We're always hypervigilant and clean and taking care of different things that are out there. My kids don't attend a regular school with different things because of their health. So as much as COVID has been a stress on everybody, it's also educated a lot of people, and it's provided opportunities that we didn't have before, with acknowledging different things that are out there that we can access now that we didn't have before. So I think that if we can look at things differently, it's also very beneficial.
Yeah, I so hope you're right, Christy. And I think it's also made us all aware about the importance of mental health and how taking care of mental health is a key part of our health.
Exactly. And yeah, our kids are going through things and they're experiencing things on different levels, and they didn't. My kids, I have one that's a senior, one that's a junior, and then I have one in 5th grade. And my high schoolers didn't get to go to prom and didn't get to do these things, but they also had health issues, which came into question. So there's a lot of things we got to do with our peers that they don't. And I think that kind of puts things in perspective on their outlets as well, and things that they can do. So it's trying to be in tune. I always tell the kids, acknowledge what it is that you're feeling, acknowledge what people are going through, and understand that talking about things moving forward is great, but if there ends up being a struggle at times, what is that? And I think just acknowledging that there is something that we need to discuss is something that is huge. And I always tell my children, I don't care what the topic is, there's no judgment. There's no judgment. We'll be honest. You don't have to lie about something. You don't have, like you said, you could tell in the labs, you could tell with different things. If it's something you don't feel comfortable talking to me about, we'll find somebody who you can.
Right. I think that kind of leads to some of these questions. We do have a few coming in here through the Q&A and chat. If anybody has any, please drop them now. But how do I, as a caregiver, cope, especially in my relationship with my spouse?
I am very fortunate. My husband's actually sitting right next to me. And so
woohoo, spousey.
I'm very fortunate with things. We work as a really well team together. We've been dealing with some of these things for the past 12 years with very, very in-depth wise. And we do a pretty good job of teamwork with different parts, but we also can communicate. And even if something sounds, so there's many times I'll start off by saying, I understand that what I'm about to say makes absolutely no sense. And then I'll say something, and usually the best thing is a hug or a okay. And no matter how crazy I sound, you just, we have to have humor, or we have to do things together. So that's been something that's great. And we also have an opportunity to where it's like, you go do your thing, I'm going to go do my thing, and that's fine.
Great. Thanks, Christy. Another question up from a parent. My teen or young adult isn't taking their meds the way they need to. What do I need to do? Because it's causing me emotional stress.
Do you want to start that, Maya? Because I do have something, but if you want to say something first. Go ahead.
I mean, I think there's a couple things that need to happen. I mean, one, ideally, and Julie really talked about the beauty of communication. And obviously, if communication was easy, you probably might not be having those issues to begin with. Often what I find is that, medical non-adherence, which is the term we tend to use. I don't love that term. I don't love non-compliance. When I was a kid with diabetes, we talked about not being in control. That's a really fun thing to tell a teenager. So, I personally really think about what does it, how do we understand what this behavior really means, right? And usually we're thinking about, this is really frustration. This is exhaustion. This is, I'm tired of being different from my peers. I'm tired of having to deal with this stuff, right? What is being expressed by that behavior? Because when we can sort of approach that with empathy and understanding, as opposed to, you got to do this, I think we stand a better chance of making progress. And we think involving the whole team. So if you've got a care team that you're working with, making sure that everybody is sort of giving consistent messages and trying together to address that. There may be changes too that could be made to a medical regimen or to a diet or to a routine that might make things easier, or might make it okay, you don't have to do that till you get home from school as opposed to in the middle of the school day, whatever it may be. But we can't think creatively until we know what the facts are.
Yeah, we try to do a lot of putting it back on them in a very polite way with things, because you don't want to have that animosity with things. But it's definitely something in our household that we used to call it the verbal judo. I appreciate that, but so I do sympathize. I understand with some of the things that are going on. What is the issue behind these things? Okay, how do you suggest we go about changing things? I'm constantly trying to think outside the box when it comes to, as we call it in this household, waterboarding our children with drinking as much water as possible, which then went on the flip side with one of them when they started dialysis. One of our children needs more fluids, one needs less. So you constantly have to be evolving with that as well.
Mhm.
When it comes to just listening and being heard, and what they're sometimes, again, with them, they're just stressing things. When you start seeing certain behaviors, I always tell my children, I am going to be that nagging mother who will wake you up and do these things, but at some point you're going to have to take some of the responsibility. And if I feel like what I'm saying or my husband's saying is not getting through to certain levels, I still need their cooperation on a lot of aspects with things. I will then, let's talk to the social, let's talk to some of these other people. Because at our point now, we're also at a transplant level. They won't get their transplant if you're not going to take your meds. But my oldest child's also been on dialysis for 2 years, and they know how much things suck, waiting and waiting. But I also appreciate the fact, and I'm grateful that they have experienced some of that, because they know how precious things are and how critical it will be. They also have a few people within our young community that they can relate to who've also been on it, that can say, oh yeah, I had no energy, or I had this, or I had that, it'll get better. So.
Great. Thanks for sharing. We're kind of running out of time here, and we could listen and speak to both of you for such a long time. It's so amazing. So I want to take us out here with one more question that's come in through chat. I'm a patient, but also lost siblings to PH1. From a sibling perspective, what resources are available for siblings who are coping with the issues that arise from being a bystander? For example, seeing suffering of loved ones and coping with that. This might be helpful for parents who have one child or patient and one who does not have the disease.
This one hits home for me. I do have one son who is my middle child to begin with. So we already have that. But his whole life has been surrounded by these other aspects, and it's not fair. But we do make sure that we include him in as many things as we can and get special attention. He's also my introvert, where my other two are more extrovert. So it's a little hard. My thing is always kind of letting him guide the way. And if I know that there's something going on, I can tell. We just try to find a way to be there and to let him find his voice with things. There have been aspects that we've learned to kind of cope with at the time, and we always just kind of just let it run its course with what he's feeling, how he's feeling, where we're going at that, and just letting him know that we're there and we love on him as best we can. But it was also important to spending our special time with him, but to include what his needs were.
Great. Maya, anything to add? Or
I'll add really quickly. Obviously, there are lots of sort of formal family interventions. There are things that hospital centers do for siblings. Obviously, grief and loss is a huge topic in and of itself that we could talk about another day. Quick plug, I run a kidney camp program up here in New York. If anyone wants to talk about sending their kid to camp, please email me. But the woman who founded that and her daughter, Judy Eichinger, wrote a beautiful book about sibling loss related to kidney disease and dialysis a couple years ago called Remembering Ruth, which is really from a sibling point of view of observing what it is to have a sibling with illness and to go through loss, that I would highly recommend. I'll send the information so we can share it with the participants.
I think we have a few more questions. If we didn't get to your questions, we definitely will answer them offline. So just know that we won't leave you hanging. I really want to give a huge shout out and thank you to Christy and Maya. Maya for sharing all your knowledge. Christy also for sharing all your feelings and sharing all your family, which you do a lot for OHF. We will be, this is recorded, so we will also share it in our YouTube channel after this for folks that want to go back and look at, go listen to it, or we also will sell slides. I mean, the slides, if anybody wants to go back and read the slides. There's a few upcoming webinars that are coming up. Thursday, March 3rd, Harnessing the Power to Make a Difference. Friday, March 11th, What's Causing My Kidney Stones? We again want to thank our sponsors for the support of this webinar series, and especially our partner sponsors, Alnylam and Dicerna. So I think that's it, ladies. Again, we can't thank you enough for everything that you're doing. This is wonderful. We have a lot of questions coming in. I wish we could get to all of them today. Again, I could listen to you guys forever. Is there any parting thoughts before we end the webinar?
I just say thank you. And if anybody wants to reach out for anything, you're not alone, and always maintain that hope. I know people are struggling through a lot of things and everybody's needs are unique upon themselves, but everybody matters. Every patient matters, every family member and part of this community. So feel free to reach out through Facebook or Messenger or email if anybody just wants to connect.
Yeah, that's a great reminder. If anybody wants to reach out to Christy or Maya, they can also send me an email at julieb@ohf.org, and I'll make sure you can get in contact with them. Enjoy the rest of your weekend, and thank you, ladies.
Thanks.
Bye-bye.